The Nairobi Metropolitan Services has started mass testing for COVID-19 in the 16 sub-counties. And we are currently joined with Gatete Njoroge, who is in Kibera. Gatete, can you tell us how many people have come out for testing?
Thank you very much, Mukami. We're coming to you live from Kibera Dio's Health Center, where the Nairobi Metropolitan Services has launched the mass testing exercise, which is supposed to take place today and tomorrow. And this exercise will target all the 17 sub-counties, or rather the 17 constituencies in Nairobi. And basically, they are coming out to test the numbers because we have seen an increase in the number of COVID-19 cases in the country. And just maybe joining me live now is Dr. Oluga, the officer in charge of health in Nairobi County, who will be able to basically tell us why they are doing the exercise now, why they need to do this mass exercise, and the preparedness that the Nairobi Metropolitan Services has put in place, and if there are any concerns about the reopening of the country and also allowing social activities is the reason as to the numbers increasing in the country. Maybe Dr. Oluga, you just tell us about today's exercise and why now. Why is the Nairobi Metropolitan Services doing this exercise at this particular moment when we're having an increase in the number of cases?
Thank you, Gatete. Thank you very much for coming to see this exercise. And first and foremost, we want to be very grateful to the Nairobians. They have turned out in really large numbers. Here at Kibera Dio, we are already at 230 people. We had prepared for all the sub-counties. We are doing this in 17 sites, which is in all the sub-counties, or if you like, constituencies in Nairobi. And we were targeting at a minimum 200 people per day, which is around 3,000 people in total. So far, we already surpassed that number just in about 2 hours of launching this exercise. But going to your questions, it is very important that we keep checking. As you already know, COVID is not over. And what is very important for the citizens to know is that even though the restrictions were eased, or some of the restrictions were eased, the regulations from the Ministry of Health on what we need to do to prevent more COVID spread still are in force, and those Ministry of Health regulations and standards need to be kept. The public health is still in force. We still need to take measures of social distancing, regular hand hygiene and general hygiene, cough and sneeze hygiene. And it's very important for us as Nairobi, because we are the epicenter. As we already are aware, Nairobi has had nearly 23,000 COVID-19 cases. We are the epicenter, actually, of the whole country. And what happens in Nairobi affects everywhere else in the country. Out of the 540,000 tests that were carried for COVID so far, Nairobi has taken the larger share of nearly 520,000. Nairobi was the first one to do mass sample population, or basically what we call mass testing. And now it's also very important that we do one at this particular point, so that we see the burden of COVID-19 in Nairobi as at now. And that's why we're doing it across all the constituents, so that we get a very representative sample. But we are also really prepared to deal with the results. We are prepared to cancel people. We are prepared to put them in our models for care. We have community-based isolation. We have home-based care models. We have treatment centers. So we are fully prepared for this exercise and the outcome of this exercise. Yes. Thank you. Thank you very much.
Thank you very much, Dr. Oluga. That is the match we have now. We are going to visit the other centers where this exercise is going on, and in our subsequent bulletins, we'll be able to give you an overview of how the exercise went. Back to you, Mukami.